Good evening, I'm Mark Kiesling. When you go to the hospital or your doctor's office, you assume there will be enough nurses there to treat you. But that's not always the case. My co-anchor Julie Williams has been looking into this issue and has more from local clinics.
Yeah, Mark, I got to sit down with Christopher Rural Health Planning Corporation. They tell me they're not immune to worker shortages, but they say luckily for them, it's not as bad as it could be.
It's our biggest asset is our staff.
Christopher Rural Public Health has 13 clinics right now in Southern Illinois. They can't operate those clinics without their nursing staff.
You know, there's no question that our staff work hard. And if we're short in nursing, then that means the ones we have to work that much harder.
Kim Mitroka is the Chief Executive Officer at Christopher Rural Public Health. She says right now they have about 15 nursing jobs open, but out of a staff of about 300 people, she says that's not too bad.
You know, I can see us starting to fill those positions, starting to see some turnaround. And we've got a great thing going here. And I think that people see the benefits of that.
Kim says that's partly because their health center is closed evenings, holidays, and weekends. That's not the case, though, for bigger hospitals and emergency rooms who have to be open 24/7 to care for their patients. That's why Senator Durbin of Illinois says he introduced the Healthcare Workforce Resilience Act.
We've got a serious challenge all across our state.
It provides a temporary stopgap to address the nation's shortage of doctors and nurses. We talked about how the entire U.S. is dealing with a nursing shortage, but it is especially bad in Illinois. A study from the University of Illinois Chicago says Illinois is the most in-need state when it comes to how many nurses there are compared to how many patients there are. That study says right now in Illinois, there are 12 nurses for every 1,000 patients.
And I'm very worried about it because these men and women have put in hours and days and weeks and months with COVID-19, and many of them are burned out and looking for relaxation, maybe even some of them looking for retirement.
And Senator Durbin says he's worried having to rely on travel nurses who go from hospital to hospital and are paid more than hospital staff nurses will make things harder on hospitals in the long run.
Their budgets get busted and expenses they hadn't anticipated, and it makes it difficult to keep these clinics and hospitals functioning as we want them to.
Kim says thankfully they've never had to turn a patient away.
I don't think I could sleep at night if I thought we were turning somebody away because we didn't have coverage.
We got to walk around Christopher Rural Health's clinic in Christopher, and we ran into Cameron Yusanovich. He's a nurse practitioner who worked through the pandemic.
There were some days where, when we were outside and we were pretty busy.
He's talking about when they were COVID testing in the parking lot. He says they would test between 12 and 1,500 people a week.
Those days were long and tedious, but at all times I was always happy and proud to be offering the services that we had here.
Can't say that we had any complaints from them. They didn't complain about what they had to do. They were very committed to it.
And I want to say a big thank you to News 3 photojournalist Paul Wilcoxon for helping me with this story. Christopher Rural Health doesn't have sign-on bonuses to get more new nurses, but they do have retention bonuses. So the longer you work with them, the more money you can earn. I have more from our interviews and a bill to help out smaller hospitals in Missouri. All of that information right now is on our website, WSILTV.com.